As we grow older, one of the biggest changes many people experience is tooth loss. And for seniors, missing teeth aren't just a cosmetic issue. They affect chewing, nutrition, speech, confidence, and even overall health. That's why dental implants have become one of the most talked about solutions for seniors today. But the biggest question everyone asks is simple. How much do dental implants really cost? In this video, we're going to break down the full cost of dental implants for seniors, step by step, so you know exactly what you're paying for and why. First, let's quickly understand what a dental implant actually is. A dental implant is a small titanium post that is surgically placed into the jawbone. It acts like an artificial tooth root. On top of that implant, a connector piece called an abutment is attached, and then finally, a custom-made crown is placed. So when someone says implant, they're actually talking about 3 separate parts, and yes, each part affects the total cost. Now let's talk numbers. On average, a single dental implant can cost anywhere between $3,000 to $6,000 per tooth in countries like the United States. In the UK, it may range between $2,000 to $3,500. In countries like Pakistan or India, the cost can be significantly lower, often between $700 to $1,500 per implant, depending on the clinic and materials used. But here's what many people don't realize. The implant itself is just one part of the total bill. Let's break it down clearly. First cost, consultation and imaging. Before placing an implant, your dentist will need X-rays or a 3D scan, often called a CB scan. This can cost anywhere from $100 to $500, depending on where you live. Second cost, tooth extraction. If the damaged tooth is still present, it needs to be removed. Extraction can cost between $150 to $500 per tooth. Third cost, bone grafting. This is very important for seniors. As we age, jawbone density decreases, especially if teeth have been missing for a long time. If there isn't enough bone to hold the implant, a bone graft is required. This can add $300 to $3,000 to the total cost depending on the complexity. Fourth cost, the implant surgery itself. The titanium post placement may cost between $1,500 to $3,000. Fifth cost, abutment and crown. The custom crown that looks like your natural tooth can cost another $1,000 to $2,000. When you add all these together, the total cost for one implant can realistically reach $4,000 to $7,000 in many developed countries. Now let's talk about full mouth implants, because many seniors ask about replacing all their teeth. There are different options. One is implant-supported dentures. These use 2 to 4 implants to stabilize a denture. The cost may range from $6,000 to $15,000 per arch. Another popular option is all-on-4 or all-on-6 implants. This technique uses 4 or 6 implants to support a full fixed set of teeth. The cost can range from $20,000 to $35,000 per arch in the United States. In other countries, it may be significantly less. Now here's the important question. Why are implants so expensive? The answer is simple: materials, technology, and expertise. Dental implants require surgical precision, high-quality titanium, custom laboratory work, and multiple appointments over several months. This isn't a quick one-day procedure in most cases. Healing time alone can take 3 to 6 months as the implant fuses with the bone in a process called osseointegration. But are implants worth it for seniors? In many cases, yes. Dental implants can last 15 to 25 years or even a lifetime with proper care. Unlike traditional dentures, implants don't slip, don't require adhesive, and help preserve jawbone health. They also allow seniors to eat harder foods like apples, nuts, and meat without discomfort. However, not every senior is automatically a candidate. Certain health conditions like uncontrolled diabetes, heavy smoking, or severe osteoporosis may affect healing. That's why a full medical evaluation is essential before making a decision. Now let's talk about ways to reduce the cost. First, check insurance coverage. Unfortunately, many insurance plans consider implants a cosmetic procedure and may not cover the full amount. However, some plans may cover parts of the process, like extractions or crowns. Second, look for dental schools. Treatment at a dental school can be significantly cheaper while still being supervised by experienced professionals. Third, consider medical tourism. Many seniors travel to countries where high-quality implant treatment is available at a fraction of the cost. But if you choose this option, research the clinic carefully. Fourth, ask about payment plans. Many clinics now offer monthly financing options that make implants more affordable. Before we end, here's one more important point. Don't choose implants based only on price. Extremely low-cost implants may use inferior materials or lack proper sterilization standards. Always check the dentist's qualifications, experience, and patient reviews. Dental implants are an investment, not just in your smile, but in your nutrition, confidence, and quality of life. If you or a loved one is considering dental implants in your senior years, the key is to get a proper evaluation and understand the full cost breakdown before starting. Because when you understand the real numbers, you can make a smart, confident decision about your health. If you found this video helpful, make sure to like, subscribe, and share it with someone who might be thinking about dental implants. Your smile has no age limit, and it's never too late to restore it.